There is some encouraging news tonight about Alzheimer's disease, which is good because we need it, especially in Alabama, where the disease has been devastating and having its worst impacts in areas that have the highest hurdles to health care, often areas that are poor and or rural and or home to communities of color. Now, what's new is for the first time, we're able to see how Alzheimer's is affecting our state on a county-by-county basis.
This is really good information that we're getting for the first time.
New data from the Alzheimer's Association shows that 15% of Alabama's 100,000 cases are in Jefferson County, the most populous county. But you're most likely to find Alzheimer's in places like Greene, Sumter, and Macon counties.
But what these findings do is they really help guide the allocation of resources to public health programs for Alzheimer's in those regions.
Meanwhile, UAB is currently working to map Alzheimer's by neighborhood. Getting a grip on the spread is critical because, as Dr. David Geldmacher points out, Alzheimer's is killing people in Alabama at the third highest rate in the country. But there is some good news. A new drug that UAB helped to study was recently approved by the FDA to treat Alzheimer's.
We're also currently involved in a study using the same agent, a study using lecanemab for Alzheimer prevention. That is for people whose memory is intact, not showing signs of dementia, but may have the buildup of the amyloid plaque in their brain. So we have an ongoing research trial trying to remove that plaque from the brain and prevent Alzheimer's disease.
Geldmacher also points out that Medicare is now considering paying for PET scans to see if people have the plaque on their brains that causes Alzheimer's.
And this will much improve access because if Medicare is paying for the scans, we can find the plaque in more people and treat it in more people and prevent Alzheimer's disease from worsening in more people.
In the meantime, Miller Piggott with Central Alabama Alzheimer's says it's important for families to seek out resources and for all of us to take the best care of ourselves that we can.
It's certainly diet and exercise. It's also, problems with social isolation. People who are more isolated tend to have higher risk of dementia. So that's an important factor. Sleep is very important. In fact, in terms of brain health, those 8 hours a day that we're supposed to be sleeping are the most important of the day. So, all of those kinds of healthy lifestyle factors are important.
Both UAB and the Alzheimer's Association say they are looking for people, especially people of color, to take part in their continuing research. The Alzheimer's Association and Alzheimer's of Central Alabama can help you with resources like adult daycare or respite care. We'll have their contact information up shortly on our website.